So you can see, sir, this is the question. Indicated structure as A is formed by defect in which structure? NEET PG 2023. Actually, it is the question of the your surgery. They are asking about the A. But yes, little information at the platform of the anatomy we are going to see. Sir, this is our superficial inguinal ring. Here is a deep inguinal ring, and this is the oblique canal, which is the inguinal canal. This E is deep inguinal ring, which is formed in the fascia transversalis. So this is the answer D. Very nice, Saurav, Vishwanath, Pranshu, you all are right. Now look here, NEET PG 2023 question. A patient presented to the OPD with abdominal pain, jaundice and portal hypertension. Identify the anastomosis between which vein? So this is the portocaval shunt anastomosis. So we should know the fact about the portal vein. Yes, at the lower end of the esophagus and our stomach, there is the anastomosis between two veins which are the part of the portocaval shunt. So A is the answer. Okay, now can you see the ligament peritoneum? Their favorite question. Yes, NEET PG 2022. Ligament derived from the marked structure. This is the abdomen part. Okay, so you can observe this ligament was asked. Arrow was over this portion. This is the your falciform ligament. So I will teach you this ligament portion. Don't worry. In the similar way, NEET PG 2022. They ask about the arterial supply. I told you the lower limb arterial supply. Yes. On the same basis, you can create it. Patient with the history of the pain in both legs while taking long walk. He was developing the toe gangrene and admits to have erectile dysfunction. Which of the following arteries involved? Yes. Very good answer. The aorto-iliac junction, because abdominal aorta is coming, dividing into the common iliac artery, then internal iliac artery and external iliac artery. Internal and external iliac artery. So, because external iliac artery is involved, that's why toe gangrene, and internal iliac artery is involved, that's why genital problem. Means the blockage will be either here or you can say here. But no common iliac artery is given. So, best answer is the aorto-iliac junction. Okay. Yes, Lerich syndrome. Very nice, Pulkit. Now, look here, another question over the ligament. There is the case of the splenomegaly, and this spleen is growing obliquely towards the umbilicus, towards the right umbilical fossa, right iliac fossa. So which ligament is responsible? Try to understand. Sir, there is a one ligament between the diaphragm and the colon. This is known as phrenicocholic ligament. So when the spleen grows downward, due to the direction of this ligament, it will take oblique growth towards the umbilicus, towards the right iliac fossa. Agree everyone? Yes, sir. This is our answer. This is the phrenicocholic ligament. Again, ligament abdominal peritoneum they are asked. This is the direction of the growth of the spleen, oblique. Now, can you see another question? Sir, child presented with the history of the fever, low backache and persistent flexion of the hip joint. Yes, sir. This is again integration with our different orthopedics and the radiology question. Yes, it is the case of the TB. Sure, one question from the TB or the leprosy, meningitis, hepatitis, influenza virus, COVID, they will be asked. So one question related to this topic. So TB in past, Pott's spine. Examination, child has an inguinal swelling. Identify the marked muscle responsible for it. So there was the arrow over A, B, C, D. Now look here. If there is the Pott's spine, in that situation, the pus will come in front of the psoas major muscle and it will reach to the inguinal region and it will cause involvement of the hip joint. Why? Because here is the one big bursa is located. Sir, this is your largest bursa of the body, that is the psoas bursa. So this is your answer. Yes, here in diagram you can observe the iliacus muscle, the psoas major. So here is the presence of the your bursa. So pus will run through here up to the hip joint. Okay, sir. So this is the your answer. Answer was the psoas bursa. Suppose it was given A, B, C and D, then C will be your answer. Psoas abscess. Very good. Now look, there is a question. Tumor of the uncinate process of the pancreas affects which of the following vessels? So in front of the uncinate process, there is a presence of the, tell me answer. Very nice, Anish. Answer is A, superior mesenteric vessels. So blood vessels you must know. Can you see another question? NEET PG 2020. Yes, we are doing the bullet train revision of the previous year question. Ligation of the common hepatic artery will impair blood supply in which part? So blood supply of the stomach you have to learn. The common hepatic artery, it divides into the proper hepatic artery and the gastroduodenal artery. Okay, fine. Now remember that our common hepatic artery, it gives the right gastric artery. So definitely the answer will be the our right gastric artery. But sir, right gastric artery is here, 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 but not here. So you can drop it. Okay. Right gastropubic is there, but short gastric artery, it is the branch of the splenic artery. Fine. Now from there, right gastropubic artery is coming and it is given here. So answer will be the A. Agree? Very good. Mrityunjay, Navya, Kaushik, all. Now look, 2019. All of the following structures are derived from the aponeuroses of the external oblique muscle. So I told you external oblique aponeuroses, it is having the three part. You can remember the mnemonic LIP. L for lacunar ligament. Yes. External oblique modification. Aponeuroses of the external oblique, it is showing the three modification. Lacunar ligament. I told you the inguinal ligament, and one is the pectineal ligament. Okay. So pectineal ligament, inguinal ligament. Two more options are there, but they are hidden. Okay. So just I am writing here. Okay. The C is lacunar ligament, and you can say one more. Suppose conjoint tendon. Suppose conjoint tendon. Remember this LIP, they are modification of the external oblique aponeuroses, but not the conjoint tendon. Remember one point, conjoint tendon is equal to internal oblique plus transversus abdominis muscle. These points you can remember. Agree beta? Fine. Okay sir. Now look for the our anterior abdominal wall. So let's start the dissection.